from a patient perspective, you're constantly worried about the quality and your safety before you would make that decision. And if we put into place systems that will make patient care safer and it's adopted across all healthcare systems, then the patient doesn't have to worry about that, right? To them, the hospital and the doctor is not what is going to determine their ultimate outcome. The outcome is going to be predictable and reliable regardless of where you have your surgery or where you get your care, because we're all using the best practice and using high reliability principles.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, I am excited to speak with Dr. Jimmy Chung. He is the Chief Medical Officer at Advantus Health Partners, and we're going to be talking about high reliability, and it's a call to action for patient safety. If you haven't heard Dr. Chung speak in the past, you're in for a treat today. He's a physician who's really taken a great interest in the healthcare supply chain. He's been active on the speaking circuit. I'd be surprised that if you've been around in the healthcare supply chain that you haven't run into him or seen him present at some point, but it's an honor to have him today. And he's going to tell us why supply chain should claim your voice. So stay with us. We're going to be back with Dr. Jimmy Chung after a short break.
I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Joining me now is Dr. Jimmy Chung, Chief Medical Officer at Advantus Health Partners, and we're going to be having a call to action for high reliability, and it's all about patient safety. And Dr. Chung, you've been actively involved in ARM. I've seen you speak on similar topics several times at the annual conference and expo. And I want to thank you for coming on the Power Supply podcast today to kind of share a little bit of your story and how you wound up getting interested in supply chain, as well as, you know, what are we talking about when we say high reliability and what our responsibility is to the patients. So again, thank you for coming on.
Thank you, Justin. This is a really great pleasure and honor to have the opportunity to talk about this.
Dr. Chung, let's start with just how you found your way into supply chain. For anybody who's been listening loyally, they might have heard you tell your story any number of times in presentations over the last several years, or even you were on the ARM podcast recently. But I just want to make sure anybody who's listening for the first time or is a newer listener to Power Supply, that they kind of understand your unique path to taking an interest in supply chain.
Yeah, no, thank you. I think most people in supply chain, we say that we didn't look for supply chain, it found us. And in a way, while that sounds like a cliche, there's some reality to that, because I think if you're passionate about something, eventually you don't know what it's called, you don't know, where the exact stage is going to be, where you're going to be performing, but it will find you, because that's where you will find the opportunity to pursue your passion. And my passion has always been looking at how can we make patient care safer and reduce waste. And throughout all of the work that I've done, both as a practicing surgeon and as a physician leader in various forms, one of the ways that it really came together was in supply chain, because that's where we can really standardize and look at ways that we can use products in a way that creates some level of reliability and consistency from the patient experience. It's how we use resources, how we can standardize the way we use products in healthcare, in treating our patients. And as a surgeon, it's one way that we can reduce waste in the ORs. And so as I pursued those areas of interest, supply chain eventually found me. And so that's where I've been in the last, I'd say, 13 years or so.
When we met to talk about this podcast, we talked a lot about how patients just place their trust in the healthcare organization. They have to, in many cases, especially when it's not an elective surgery, they have to accept their circumstances. They have to do that sometimes on a very quick basis. It's not something they get to prepare for. And then they come in and they receive the care. And you were talking about the role of trust as we set the table for the conversation around patient safety and really, what that trust really entails and the great degree of responsibility that, no matter what your role is in the healthcare organization, how important it is, that you defend that trust that they have when they come to receive care. Can you expand on that?
Yeah, absolutely. And I think the bottom line is that we as caregivers and in a general sense, physicians, nurses, any kind of clinician who's taking care of patients for their health, we have to earn their trust. And to earn their trust, we have to demonstrate that what we do is safe and that they can rely on us to provide a consistent level of reliability and safety in regardless of which hospital they go to or which physician they end up with. There needs to be a basic level of safety and security from the patient's perspective. And I think historically we have not done a very good job. And to expand on that a little bit, let me take you back to 1999, where there was a report that came out from the Institute of Medicine called To Err is Human. And in that report, it stated that there were about 100,000 per year in the United States caused by preventable errors. And of course, that was a shocker to most people, especially the physicians and the medical community who really pushed back on this in the beginning. And no one could believe it. Even the experts and the academic centers all pushed back and said, well, it depends on what you mean by preventable, or that's not possible. We're doctors, we don't make mistakes, and that was really the response that they had. And so that number continued to be studied further to see, okay, well, let's make sure that we are really looking at preventable errors and what kind of data are we looking at. And it turned out that it wasn't 100,000, it was actually more. And in fact, the closer you look, the more we find. And 25 years later, it still remains one of the highest causes of deaths in the United States, right after heart disease and cancer. It's the third highest cause of death in the United States. Now, there's been some debate over that, I admit. We think there's about 100,000 or 400,000 deaths now per year that are caused by preventable deaths. And we're just actually looking at the acute care setting. We're not looking at outpatient care. And you could debate over, well, maybe the number's too high, maybe we're overcounting, there could be other circumstances, et cetera. But the bottom line is there's still way too many deaths that are preventable by preventing errors. Now, I don't think most of the public realizes this. I think we as a member of the public, we like to think that hospitals are places where we can go to get care, where it's safe. People run the hospitals when there's a local disaster. If there's a healthcare catastrophe or some other natural disaster, people tend to look at hospitals as the place for safety. But the health system as a whole could do a lot better in terms of adopting some of the basic principles of high reliability into care pathways, into the protocols, et cetera, to make healthcare safer. And that's really how we would earn the trust of the public, Justin. It's not through just claiming that because we're doctors, we know what's best for patients. We really have to do a better job at making a safer environment for patients.
Yeah, there are obviously multiple factors, and I think you're teeing up the focus of the conversation today by, telling everyone that one of the factors at play is, not having adopted the principles of high reliability. And so we're going to table that because we're going to take a deep dive in a second. But what are some of the other factors you think that are at play with why, there are still just, too many medical errors? I think you had told me like 1 in 100 chance that something will happen related to a preventable medical error is currently the statistic. So that's 1%. That, 1% seems small when you're talking about things that maybe don't impact your life so substantially, but when you're talking about people's lives, 1% seems like a high number, right?
Well, 1% refers to the risk of an adverse event, a serious harm or possibly death due to a preventable medical error. There's actually a lot more errors that you probably as a patient won't, maybe it won't directly impact you, but people make mistakes all the time. Now, that said, I don't want to necessarily say, well, in medicine, we don't care. We don't take, care to reduce errors. It's just that humans, by our nature, we are designed to make mistakes. In fact, sometimes I think it's actually a feature, not a flaw, as part of our evolutionary development. But, most of us in our regular lives make about 10,000 decisions a day. About 0.3% of the time we make a mistake. So we make about 30 mistakes a day. But we put into place guardrails or tools that will help us either correct the mistake or prevent the mistake, right? So for example, maybe before you walk out the door, you do a quick double check to make sure, okay, do I have my wallet? And you check your pockets to make sure you have your wallet before you walk out the door. Or you might say, well, I want to make sure that when I go to the market, I don't forget the milk. So I'm going to make a list. So we make lists, shopping lists. And so every day, I think we even think without thinking about it, put into place tools and processes that will help us prevent some of those mistakes. In industry, the same happens. We talk about the airline industry as a perfect example of how they've put into place fail-safe systems into their processes to make sure that they don't forget anything. And that's why, airline travel is so much safer these days. The same kind of processes occur in pretty much everything that we take for granted, like the military, for example, or public utilities, or even something as simple as your local coffee shop that makes your favorite coffee. Every time you go to that coffee shop, you want the same latte to taste exactly the same each time. And if you're a Starbucks fan, you expect that when you go to a Starbucks in one city and go to another one across the country, you expect that to be the same. And in healthcare, we would like it to be the same for patients, so they don't have to worry about, if I go with this doctor and go to this hospital, will I get better care than if I go to this hospital and that doctor? And so from a patient perspective, you're constantly worried about the quality and your safety before you would make that decision. And if we put into place systems that will make patient care safer and it's adopted across all healthcare systems, then the patient doesn't have to worry about that, right? To them, the hospital and the doctor is not what is going to determine their ultimate outcome. The outcome is going to be predictable and reliable regardless of where you have your surgery or where you get your care, because we're all using the best practice and using high reliability principles.
I'm still thinking about the 30 mistakes and trying to figure out where I made them today. It really is, though. It's kind of telling, right? Because I think a lot of times when we make the mistakes, we might just we might recognize them, but we minimize them, right? So we can just move forward with our day. And that's a lot harder to do in healthcare, because there's a weight on that, because those mistakes are not just impacting, your own daily life, right? It's impacting others. And so I kind of hooked onto that one. It'll be interesting if I start counting my mistakes tomorrow to see how I'm performing over under on that. Let's talk about what's been done to address some of this preventable medical errors over the years, right? Like, especially as we are leading up to today. What has been, I mean, obviously back in 99, this information comes out. You talked about taking a deeper dive, but what were some of the actual actions that were taken since then to help make improvements?
Yeah, well, obviously the government took this information and jumped on it right away. Healthcare, or I guess the medical community and organizations, were a little bit slower in adopting some of these principles. So as you might recall, back in the late 90s and early 2000s, as a reaction to these medical error reports, certain things started becoming instituted at hospitals. One example is what we now call the surgical pause or timeout, where before every surgery, you would stop and make sure that you've got the right patient in the room, that you're doing the correct side, left side, right side, that we've addressed any kind of potential issues that might come up, et cetera. It's a pretty long checklist, and actually the World Health Organization standardized this checklist, and it would have taken about 90 seconds to do the entire list. Well, surgeons at the time felt like, well, we don't need a list. We're smart enough. We don't have to, go through all this. And so it was not adopted uniformly, but a lot of the hospitals just kind of stuck to it and said, well, let's do a brief list. Let's do a shorter version of it. Let's at least do something. And, for example, one of the elements of the list was that everyone who was in the operating room, regardless of who you were, had to introduce yourself and say out loud what your role was. And now, of course, if you're in a small hospital where you're spending the entire day with the same crew, the same team, you might think, well, that's ridiculous. We all know each other. We don't need to introduce ourselves and tell everybody who we are. And it's because in that hospital setting, people don't understand the reason behind that. The reason behind that isn't because we don't know each other. The reason behind that is because it starts the case with every person in the room expressing their voice, so that everyone's voice has been heard, so that if something does go wrong, they have the voice to speak out. It's a way to create that level setting culture in that particular small, high intensity environment. It's very similar to what pilots do, before they start a flight. And I've interviewed a few pilots about how they do these things. And yeah, I mean, I have a co-pilot. I've been flying with them for 10 years, but we still go through the same checklist every single time, because that's, it puts us in that routine so that we don't forget anything. Because if they don't, they will forget something. And, and then when they forget something, again, like you said, just like in healthcare, if something is forgotten or an error, even the smallest error could lead to a really poor consequences. And so because the lack of understanding of why these elements are important, what is actually behind the principles of high reliability, hospitals were very slow to adopt some of these principles. Other things that hospitals adopted were things like repeat back. And again, not something that was very popular. If you're a nurse and you call a doctor for a verbal order and say, Doctor so-and-so, this patient is having problems with this, can we get an order for such and such medication? The doctor might say, okay, yeah, go ahead, and then leave it at that. Now, that can lead to some significant errors because the nurse might not know exactly what the doctor wanted, or maybe the doctor misheard the request for a medication or the appropriate dose. And so the best practice, of course, is for the doctor to repeat back what the nurse said, and then the nurse to repeat back what the doctor said to finalize that order, to ensure that the correct medication and correct dose was being ordered for the correct patient. And it's interesting how many errors still occur because of the lack of willingness to adopt this practice. And there's a lot of other examples of this, where even certain medications that have similar names are kept in in on the floors of the hospitals, they have these trays where these medications are kept in certain places, called a Pyxis machine. Other places it's called something else. But sometimes similar sounding medications are kept close to each other, and you can easily make a mistake by grabbing the wrong vial. This is actually an example that happened to one of my patients, and so I remember this very distinctly. And so a lot of these things were identified. Most hospitals have a quality department where they look for these opportunities and try to fix them ahead of time. They try to put into place systems, like I said, to try to catch our humanness, if you will, before we are allowed to make a mistake. The other thing, to answer your question, Justin, is more and more hospital leaders are looking to creating what's called a just culture in hospitals. Even back when I was in medical school and residency, if we made a mistake, we would stand before a big, group of professors and peers and students and tell them why we made a mistake, and then basically we would just say, well, we'll never do it again, and that was the end of it. We took accountability for the mistake that we made, and therefore, because we took accountability, we'll make sure it wouldn't happen again. Well, when we study how humans make mistakes, that's really not the best way. Because, like I said before, humans by nature will make mistakes. The best way to prevent a mistake in places where we don't want to make a mistake is to create systems that stop us before we make those mistakes. And so in a just culture situation, that means that if you do make a mistake, you need to be the hero by calling it out and saying, hey, I made a mistake here in this situation, and to prevent me or anyone else from making that same mistake in that scenario, we need to change the system so that we change the process, or we put a checklist in place, or we do this or we do that, so that we make system changes. And so no one's afraid to admit that they made a mistake. In the old days, you were ashamed if you made a mistake. So people would actually not even share their mistakes. They would hide them from people. And that just creates a scenario where other people are going to make the same mistake if they were put into the same situation. So a lot of these things have been put into place, but I think the data still scares us, because despite having all of these things put into place, the just culture, the cause analyses, and the timeouts in the ORs, we still have a serious issue with medical errors. And, I'm not going to be the one who's going to be able to say, well, this is what's causing it and we need to do this or that. Bringing it back to supply chain, what I will say is that because we still have a serious problem with medical errors, wherever we can reduce variations and variability in the way we deliver care to patients, the more we can reduce the unnecessary variations, the less likely that we will have an opportunity to make a mistake. For example, in the operating room, if you have 10 surgeons who are doing the same procedure but using 10 different products, then that's 10 different ways that the medical staff or the OR staff has to be trained in how to use a product 10 different ways. And that's that many more ways that you can make a mistake. So if we can reduce that variability, then we can try to at least reduce the opportunities, create a system, like I said before, create a system where we can reduce the potential to make mistakes and thereby making it safer for patients.
You're kind of touching on the plight of supply chain, right? Is how do we reduce product variability? And I just want to lean into that as we're getting close to the end of the interview, because I think sometimes supply chain doesn't feel close to the patient, right? Like as a clinician, and I worked as a nurse for many, many years, I think we have a natural connection to the patient because we've worked at the bedside. But for many supply chain folks, they don't have that bedside experience necessarily, but I think they do have a very strong understanding of the impact that variability has on the consistency of quality delivery. Even just issues with ordering and reordering, the more SKUs you have, the more difficult that job can be to manage that. And so, there's been lots of consolidation efforts, and now we're balancing the equation between consolidation and resiliency, knowing that we have backups in the event of disruption. And so it seems like a bit of a yo-yo effect. You get yanked one way and then you get yanked the other, and finding the best balance for your organization is kind of I think the plight of the supply chain leader today. But I really want to connect with that patient safety piece and say, okay, we know that variability is a factor, but what else would you recommend for, healthcare supply chain individuals? Because I don't, not necessarily leaders. To your point, everybody has a voice. So it doesn't matter what level in your organization you happen to be working in supply chain today as you're listening to this podcast. We all have a part in that, and we all impact patient safety. What would you recommend that they do to kind of lean into this, at least as much as supply
Well, I think
chain
the most
control?
important thing is to recognize that healthcare delivery is a team effort. It's not just supporting the clinicians, and they're the ones who deliver healthcare. And I think that's a mindset that I think we all need to really think about a little bit. Some of us say it. And of course, yeah, it's a team sport, but I don't think we really think deeply enough about it, because ultimately I still hear people say things like, oh, we leave that decision up to the doctors, or the doctor knows what's best for the patient, and they get to choose the product and we just deliver it to them, or, in that kind of way. I think, you don't have to know how to do a surgery to know that you're actually a part of delivering the care to a patient, and that you are an expert in things that you're an expert in. And so, I think and I know this is much easier said than done, but I think we meaning supply chain professionals as a whole, need to step up and be a part of the healthcare or the care delivery process, and don't defer too much to the physicians. Now, we also don't want to antagonize physicians or nurses or clinicians, but we have to recognize that we're going to work together as a team. So there are things that supply chain professionals have told me, even when I was a practicing physician, that I learned from. And I said, oh, well, I didn't know that was how it's done, or I always thought that it was normal for me to do surgeries with the rep in the room, and then they would just bring whatever I needed from literally the trunk of their car, right? We call that trunk stock. And I just thought that was the normal way of doing things, and obviously there's much better ways of getting products that we need into the operating room at a cost that's affordable. And so, challenge your physicians, educate them, and remember, at least maybe not out loud, but in a more holistic manner, that perhaps the physician alone doesn't know what's best for patients. We together, and including, I'm going to say, data, potentially even AI tools in the future, all of us put together knows what's best for the patient. And ultimately, the patient knows what's best for themselves. And so bringing all of those things together is going to help us make the best decisions. And aside from, like you said, reducing variations, thinking of what we do together from a team perspective, and not being deferential to physicians, I think is going to really help us in the long run.
Dr. Chung, really great advice for supply chain. And I just want to thank you for leaning in to helping build that bridge and giving a voice to supply chain from a clinician perspective, and help bridge that gap. Because I think, if you're going to change that kind of prevalent physician deferential culture, it's going to take a physician to help empower non-clinicians to value their role and be empowered to speak up and give them that voice. And so, when we kind of prepared this outline, you really inspired me. And I was thinking, right, supply chain needs to claim their voice in the healthcare delivery model, and realize, if they don't already, I'm sure there are many that have claimed their voice, but everybody should claim their voice in the healthcare supply chain to be, care providers themselves, because ultimately that's what this is. It's a care delivery model to patients. And so you're all care providers. And I just want to thank you so much for helping elevate and bridge the supply chain into that care delivery model that much more closely.
No, absolutely.
So thank you so much for coming on the show. Yeah.
No, absolutely. And I would just say one last thing, that you'll be surprised if you are a supply chain professional out there and you start talking to physicians, you'll be surprised at how many of them actually will listen to you. Most physicians, in my experience, are actually open to learning more and improving and doing things better. And so take that chance, have a conversation, like you said, be vocal and own your voice in this, and we can all work together. So, but thank you for the opportunity. I really enjoyed our conversation, and hopefully we can have more in the future.
That was Dr. Jimmy Chung, Chief Medical Officer at Advantus Health Partners, talking about patient safety, but really it's a call to action for high reliability. And I'm still thinking about the 30 errors and where I can improve. I think just the key takeaway for me is supply chain. Go out there, take the chance and claim your voice. If you haven't established a rapport, no matter what level of supply chain you are in your organization, starting to connect those dots and bridge those gaps, it's only going to help elevate the voice of supply chain and lend credibility. And I think Dr. Chung gave us a great takeaway, which is make sure we use data. But that tolerance for variability, it's at the root cause. And also that deferential physician culture and the tolerance for variability is at the root cause of a lot of the medical errors that are happening. It's still shocking to believe that that's the third leading cause of death in the U.S. and that there's a 1 in 100 chance that something bad will happen due to a preventable medical error. So thanks again to Dr. Chung. I love the fact that as a physician, he's leaned into the healthcare supply chain over the last 13 years. He's actively involved in ARM and, grateful for him offering up his time and insights today. On behalf of Hayes and Gary, who couldn't join me today, I'm Justin Poulin. Thank you so much for listening to this episode of Power Supply.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.